A majority of concerns about kids and health is centered around COVID. However, the flu is also here, and it is a concern for parents. Children's Hospital reports they've had a total of 496 positive flu tests since the season began in October, with the majority of those cases, 470, happening in December.
Yeah, Dr. Heather Edgley has some important advice for families.
We are definitely seeing a lot of flu. Normally we see flu in February, January, February, but we're seeing it a lot earlier this year. And I'm sure that this has something to do with COVID and the fact that kids have been back in school. So you're going to have fever, cough, cold symptoms, vomiting, body aches, headaches, sore throat, all those awful things that just make you feel like a Mack truck has come by and hit you. Some patients are candidates for Tamiflu, but not all. And it's not always recommended depending on what kind of other problems your child might have. So you'll have to talk with your provider about whether or not it's indicated for that particular patient. Otherwise, we're talking TLC, so rest, fluids, lots of drinking, Tylenol and ibuprofen. That's the main thing. If there's vomiting, we certainly can offer things like ondansetron, which is Zofran for nausea and vomiting. COVID is primarily spread by droplets. So you know that that's coming from your nose and your mouth. So the mask is the best way to prevent from COVID. With the flu, it's going to be a little bit more contact related. So we want lots of hand washing, covering your mouth when you cough. Mask is always still definitely helpful, but hand washing is extremely important. So hand sanitizer, hand washing, staying home, quarantining when you're sick. Kids should get the vaccine starting at the age of 6 months. Now, first time you get a flu vaccine, you'll have to get 2 doses, one followed by the other one at an interval. But after that, you only have to get it once a year. But everybody needs to get a flu vaccine every year because the flu virus does change. The predominant strain changes every year. And so we try to predict which one is going to be the most common for our region and produce a vaccine that is hopefully the right one for that year. And some years we have really good guesses and some years not so good of a guess because it is always a gamble. It's really dangerous for elderly folks in general. The young and the old are also going to suffer the most from any kind of disease process that's infectious. So very, very young, meaning, under 6 months, under 2 months for sure, and then older folks. So if your children have the flu or they pick it up somehow, they give it to their grandparents who are not vaccinated, it can be deadly. I recommend that you come to the emergency room, urgent care, your pediatrician or your provider, whenever you feel like your child is really sick. So if they've had high fever for several days, they are lethargic, they are not urinating, they have had respiratory difficulty, not just a cough, but really difficulty, they absolutely need to be seen.